All right. Hi, everybody. I'm Dr. Regan Tilley, and welcome to our Biote seminar. We have a slideshow presented here for you, and we're going to share some testimonials, and then we have some fun information for at the end at a question and answer. So, welcome. All right. So, what are hormones? Why are they important? And what is hormonal imbalance? So, hormones are the messengers of the body. They have to carry signals around and tell our organs what to do with that signal. We have hormones made from our thyroid gland, our adrenal gland, our gonads, so ovaries or testicles, and several other endocrine organs in our body, like the pancreas. And why they are important is because if you don't have enough, the message doesn't get delivered, or the wrong message gets delivered. And so when they're out of balance, they don't just create havoc in one system, they create havoc in the whole body. So when we have one issue, we have to nurture it, but we also have to support the rest of the system while we do healing. And so if there's a hormonal imbalance, it means either the levels are high, the levels are low. Most frequently when we talk about replacement, and most of the issues tend to be low. So we'll have hypothyroidism. We will have hypogonadism, menopause, andropause. Forgot to turn off the music because it'll get a little loud there in a track or two. But if they're out of balance, we end up not functioning well. You've heard some testimonials already about how badly people were feeling before they found treatment. And what we want to do is create the opportunity to bring your hormones into optimal balance. So what you need to know, who can you believe, who should you believe, what can you potentially do? So what you need to know is what your hormones are. As you can probably attest, you've maybe gone to a provider and said, I just don't feel right, I'm tired all the time, can we check my hormones? No, you're not old enough, or you're in menopause, so of course your hormones are out of balance, we aren't going to do anything about it. I can give you some Pro. We'll talk about that in a little bit. Or again, here's your antidepressant, here's your sleeping pill, here's your blood pressure pill, your diabetes pill, and because you have all those, you need an aspirin and you need a cholesterol pill, and. Okay? So you need to know what your values are so you know what needs treated. Who can you believe? Who should you believe? I am on a little bit of a soapbox about Big Pharma these days. And if anybody's seen my post on Facebook, I shared a little bit of the rant. But what I will say is trust your gut. You need to go to somebody who listens to you, who listens to your symptoms, who understands that we are a whole system. We are not one system independent of the others. So your cardiologist, nephrologist, OBGYN, neurologist, rheumatologist, endocrinologist don't talk to each other. They treat their one object and they disagree. Functional medicine, it's like a love-hate relationship with traditional medicine. We need traditional medicine because they do save lives. They do have life-saving therapies that have been discovered that we need and that have helped us. However, they don't feel strongly or don't understand how to create ongoing health. They might save your life in the ICU and you come out with hypothyroidism and they'll say follow up with endocrinologist or your primary care doctor. You go to a primary care doctor, they look normal, they're fine, you recovered, your TSH is 4.2, it's fine, you're in range, okay? Again, I want you to do your own research. I want you to read. I want you to understand yourself. And I want you to be a firm advocate to find the person that's going to listen to you and help you get to your most optimal self. And what can you potentially do? I kind of said that, but you can be proactive. You can seek out an event like this where we can talk to you about what your options are. So we kind of talked about hormones a little bit. They're the chemical messengers. Your hormones have a particular protein shape and they find the organ that is their target and they go link up and send the message and activate that cell. They turn on genetic function in the cell nucleus and start the process going to create the next protein that we need in our body to build. Do we age because we lose our hormones? That's a loaded question. We age because our telomeres get old, or we are exposed to toxic environments, or we have had a traumatic event. There's a lot of things that create aging, but we do know that hormones can slow down aging because they decrease the inflammation in our bodies and allow us to not age as rapidly. And do we lose hormones because we age? Again, it's chicken or the egg. traditional medicine will say, you get old, you lose your hormones. I even had that thought process not that long ago, that it's natural. We are created to go through menopause. We're created to, age, and all of these things change. But the question is, why does it have to be difficult? Why does it have to be kind of ungraceful? A lot of the whole, I'm going to age gracefully. Well, how about we help you age optimally? Okay? Stay at our peak. We're living longer. There's no reason our hormones should be petered out in our 20s and 30s, and then we just have to deal with it as we age. So we have actually seen patients treated in their 90s with hormones, and they're thriving. Their bones are strong, they're spry, they're up and moving around, and sharp. So do you feel like this, run down, over it, just done halfway through your day? Or would you rather feel like this, where you've got a great relationship because you can communicate well, your mood is stabilized, and you have more energy? This is another guy who just is depressed. That depression is a big deal. Do we want to be happy? Do we want to be confident? Do we want to have that outlook on life that I can handle today? It's not awful. So do any of these symptoms sound familiar to you? Anybody, can anybody pick some of their top 3? What would you say?
Mine is anger.
Okay, that's
My
a big
job
one.
is very stressful, and I fly off the handle, and
Okay.
I haven't in my whole life been like that.
Okay.
My employees will tell you.
It's a big thing. And mood is huge.
And I don't like it.
Sure. And it makes you feel out of control.
Oh.
So, yeah. Yeah. Anybody else want to share their top or top 2?
Flashes.
Uh-huh. And how long have you dealt with that?
Flash. It's more like a power surge.
Right? Vroom, and on it comes. All right. Do you have any symptoms that...
Weight gain.
Okay. Joint pain's a big one. And joint pain is, it's a miracle. It's so nice when it's not so bad. Yeah.
Joint pain and anxiety were my biggest ones.
Yeah.
I think, and fatigue.
Yeah, fatigue, joint pain.
Yeah. And definitely all of those. There's very rare times now that I'm having that panicky feel.
Good. Yeah.
I was almost constantly feeling. So it's just like this, I don't know, it's almost just like I don't understand, what am I missing? And it's the anxiety because I've had it for so long. So.
And that's a great thing to be rid of. Some of these other symptoms, we actually have protocols in our pelleting to help specifically with migraines for women, whether you're menopausal or not. So we have ways that we can help with that. As far as sleep, one of the first things I think the majority of folks notice is sleep gets better, like that. My husband his pellets ran out a month ago. Like he's like 7 months out. He needed them, but job requirements made it so he couldn't have them. And yesterday he said, I need my pellets. And he snores when he hasn't had his testosterone. And once the testosterone's in, the snoring even gets better. So that's a huge thing. So with the Biote method, some of the reasons we went with it are because they provide us with highly studied dosing protocols. They use an algorithm with 300 points of data that help us optimize your dosing. They are a 503B pharmacy, or they utilize 503B pharmacies, so we have FDA approved ingredients in the pellet. And there's a whole talk about FDA approved versus FDA cleared, etc. And so that's something we can talk about later. Nutraceuticals are huge. They have kind of put together a phenomenal spectrum of Thorne-sourced, in general, it's Thorne brand, Biote specific supplements that are made to work best in folks that might have MTHFR problems, so that your B vitamins are methylated so your body can utilize them well. We use hormone balancing supplements called DIM that help your body organize the hormones and put them where they're supposed to be and help your body excrete them the way they should be. And so there's a lot of reasons that we love this company. So andropause, this one's for the men in the house. So it's the male version kind of menopause. The problem with traditional medicine is it's normal, okay? The traditional medicine range of testosterone is 200 to 1100. When you're 30 years old and you have a testosterone of 200, that's the testosterone of an 80-year-old. That's not okay, but traditional medicine won't touch it. And so we address that. So it's really common in men over 45 to have low testosterone, but we see it in even younger men. men that have comorbidities such as diabetes, high blood pressure, sleep apnea, and other chronic disease, their testosterone is often low because their body's just working so hard. Testosterone is considered not important to the body's system trying to stay alive. It's literally trying to stay alive. And sex hormones are low man on the totem pole. But we know if we get that optimized, it allows the rest of those conditions to be easier to control. So it's linked to early heart disease, and we have a slide about heart disease coming up, and it's very much underdiagnosed. And so what is testosterone? So it's the primary ingredient in the pellets that we administer to both men and women, because both sexes need it, both sexes have it, men just have more of it. But women, we've learned, and we'll talk about that shortly, benefit with more than less. And so what we need to understand is that as we age, we start losing it in production. And women, as early as 20, start losing it rapidly. So this is a slide that I really like, and we have this on a content card that we keep at the desk to discuss when we get results back, because you'll forget this, and then we'll have our labs in front of you. These are thresholds for illness, okay? 900 is normal. We optimize beyond that, because if you're less than 900, it puts you at higher risk for Alzheimer's disease. If your number's here, it's erectile dysfunction. So that's something palpable that men may notice. But all of these other issues come on at higher levels of testosterone. So it's like the last man on the totem pole again. It's the visible symptom that will bring men in. But all of these others, we need to look at testosterone if we're worried about any of those. So these are some of the effects of bioidentical testosterone replacement for men and women. So we've already talked about increased energy and vitality. Overall well-being improves dramatically. Anxiety's improved, depression's improved, cognitive clarity. As Amy said, I can finish a whole sentence now. And they know when mine have run out, because I have a tendency to like drag my feet. I'm like, I'll get it next week. I'll do it later. And Kate's come in. You're getting your pellets today. All right. So those are some of the neuropsychiatric things that get better. Libido, enhanced performance. So when you're trying to keep your body composition healthy, what we see when we age is we turn more fatty, we lose muscle. And that's because hormones aren't there to tell our body what to build. And so when we have testosterone, after a couple of years is usually how long it takes, but we'll start seeing much improved body composition. But that's one of the later things we can like measure, but it starts right away. With the bioidentical testosterone, we have a white paper on this about breast health protection, prostate cancer protection. When testosterone is optimized, it's actually protective. It's when it's low is when we actually are at more risk for those cancers, not necessarily high. And that's kind of one of those gray areas with prostate cancer. We have to be very careful, but at the same time, if we have you optimized, your risk goes down. So that's one of those things that we work closely with our urologist in town on to make sure that we are doing proper surveillance. Heart protection, bone protection. The one diagnosis in a man that I can get this type of therapy covered for is osteoporosis in a man, because testosterone is so highly correlated with it, but it also helps women keep stronger bones. And there's more increase in bone density after a year's use of the testosterone pellets than there is with Prolia, with the calcitriol inhalers, and the other bisphosphonates, which is the bone growth promoters that endocrinologists used. Increased muscle strength. Amy and I, we built the sauna 3 weeks after we got our pellets. We didn't need a man. We built that thing by ourselves. We did need her husband to come up and wire something on the top, but that's because he wanted to help. So, but yeah, reduced body fat, and it actually, over time, we'll see lower cholesterol levels. And so menopause, this is the one for the women. This is where our hormones start to peter out, and the symptoms may begin 15 years before you actually go through menopause. So in your 30s, when you're having mood swings and your periods are getting irregular and your OBGYN, well, let's push on birth control. How about a Mirena? How about some Depo-Provera shots? It's hormones, but it's the wrong kind. They're not the clean kind, they're not the healthy kind, and they're not the kind that's gonna do the work to help you actually feel better and be healthier. Getting over and getting through menopause doesn't necessarily completely happen. What we have is you get used to it and it becomes your everyday. Some women go through it Like they blink their eye and it's over, but that's not the majority of women. So we're here to help you get through the premenopausal phase, help you get through perimenopause when things are going super wonky, and then when menses finally stops, but those symptoms are still there, we're there to help you for that too. So menopause is a game changer when it comes to women's cardiac health. So 1 in 7 women that are premenopausal die from heart disease. You go through menopause and it's 1 in 3. And that is a huge statistics. And we have documentation that with proper hormone replacement, this number goes down. It's not as high of a ratio in women. Estrogen is, we call it the women's hormone, but men have some too. We monitor that in men because we don't want to over-estrogenize our men either. This is kind of the flip-flop. There's a large amount in women and a small amount in men. It has an enormous number of functions in the body. So when it's off, there's this condition called estrogen dominance that we watch for. And if your estrogen's elevated or high normal, even in menopause, because our adipose cells store it and create it and make it and still keep circulating it, we don't always have to replace estrogen. It's not until your body isn't deficient from it that we actually replace it. But we watch it because it has so many activities in the body. We do use it, and we adjust the dose appropriately to control your hot flashes. It helps to maintain bone density, memory. Oftentimes we see women say, I aged like 5 years this year. And so that may be part of that. Your estrogen stores have really depleted. So it helps maintain collagen. And then serotonin and dopamine, those are the happy hormones. So anger, depression, anxiety, PTSD, just kind of having the hair trigger. When that isn't in proper balance, that's what we see as well. So these are some of the positive effects that you can see with human identical estrogen replacement. So we're going to see improvement in hot flashes, increased skin tone and elasticity, less of those mood swings, kind of just a repeat of what we talked about. And again, heart protection, bone protection, breast and brain protection, and neurodegenerative conditions. Those are things like Alzheimer's, Parkinson's, cognitive deficits. Those can also be protected by using hormones appropriately. So hormone therapy, there's lots of different kinds. And in training, as any of us who've gone through medical training know, they tell us about pills, patches, and shots. Bioidentical also can include pills, patches, creams, gels, and pellets. Synthetic hormones are not bioidentical. They are similar-ish. Premarin is from a pregnant mare. That's where Premarin comes from, the name of it. We aren't horses. We don't need horse urine. We don't need the hormones from that. A lot of the progesterones that are given are synthetic, and a lot of the studies that we hear about increased risk for breast cancer and things like that are progestins, which is not progesterone. Progesterone is what's in our body. Progestins are many chemical molecules off from our progesterone, so it's not even really close, and there's a lot of dirty byproducts when our body's trying to excrete it. With bioidentical pills, we can have those compounded. We use troches, which are dissolvable things that you put under or between your cheek and gum, and that is a way to absorb them. That takes twice a day use most of the time, and it's usually 2 or 3 compounds that we're having to utilize. Creams and gels are what they say they are. You apply them on kind of some thin skin areas on your body. You have to be careful who you touch if you apply them. You have to wash your hands. If you're using a testosterone cream, there's a whole video that you have to watch and agree to. Rinse off the handles, wash your hands, dry your hands on the towel, take the towel and immediately put it in the laundry so nobody else has the accidental risk of exposure to testosterone, because it's so strong and potent. They don't want the women in the man's life that's getting it, or the grandchildren or the children, to be exposed, because it can cause a lot of issues. And then we have pellets, and that's kind of our jam, and we'll talk about that more. So again, this is conventional hormone replacement. This is that Women's Health Initiative study in 2002 where everybody just got taken off their hormones because everybody had heart attacks and had strokes and got breast cancer and ovarian cancer and uterine cancer because of the hormones. Well, they used the wrong ones. And they didn't study separately the bioidenticals that some women had doctors savvy enough to utilize. They didn't separate those out in the study. And so the numbers looked awful. So the blood clots were higher risk because we were using birth control pills. We were using estradiol, and like Premarin, Prempro had the progestin with it. And so that was what was the molecule that was creating the problem. Patches, they can be really helpful compared to pills. You have continuous release. You don't have to take a pill all of the time, but you do have to change it. You get some weight gain. The problem is they also don't work well if you're overweight. If you're overweight, then it's diluted and it's not effective. You can't use the birth control patch because your adipose tissue absorbs too much and it doesn't work. And so hormones may not go through the skin. Your skin might be too thick, and thick isn't the right word. It may be too resistant to allowing things to absorb through it. And so you need things to assist it, and that's where the creams and gels come in, because there's some additive ingredients that pushes it into the lipid bilayer of the cells. So it's there. I have some folks that have used it and they've had decent results, but I'm not a huge fan. We talked about creams and gels. You got to put it on 1 or 2 times a day. It's kind of messy. I've had a lot of women before I knew about Biote that we were trying the topical creams, and they're like, I'm so tired of rubbing creams into my belly or my arms or my thighs. It's like all I do for half an hour is just rub things in and it doesn't absorb well. And so you don't want to give it to your pets. You don't want to have a baby get virilized. We don't need babies growing mustaches or any of that stuff. It's a problem. So estriol doesn't protect the bones, heart, and brain, and oftentimes we use Biest or Triest in those formulations, and it's just multiple types of estrogen to make it feel like there's more estrogen in it, but it's not really effective. Our body doesn't use it. It makes it and then gets rid of it. It's part of the metabolism of the hormone. Did it quit? It did that to me earlier. Hold on, let's try that, and I'll put it back in, and that's what it took last time. I just had to be, there you go, wake it up. So injectable, again, this isn't my favorite. A lot of people do it. Most of the time they're synthetic and have a lot of dirty metabolites that your body doesn't process out well through the liver. And this is where we have higher incidence of liver toxicity and heart disease, because the dirty hormone, the compound that gets circulated through second pass, it uses up the stuff that the body likes, and then we have this kind of broken hormone that goes in and wreaks havoc in the system. And so it's not my favorite, and I tend not to prescribe it unless people they just don't have the funds, because it is a little bit more affordable. Guys get cranky because what happens is it's peak and trough. It goes really high and then gone, really high and then gone. So they get, like, I want to say roid rage. That's kind of, tongue in cheek, but you get a huge bolus of testosterone and you're good to go. And then it falls off, and then you're back down to feeling as bad as you felt when it started. And so we have guys that were trying to take it twice a week in smaller doses to try to keep the levels more level. A lot of times what happens is you get a shot every 2 weeks, and then it's every week, and then that's still not effective. And then we go to twice a week, and then it becomes you're getting poked all the time. That's another thing I don't love about it. So with bioidentical hormone pellets, they're natural plant-derived compounds. They have the same molecular structure as the human hormones, so it's not trying to put, a key that doesn't quite fit and pick the lock. We want it to work in the key set. Most of the pellets for most patients last between 4 to 6 months. We have some women that need to have them a little earlier, and men sometimes go a little bit further, but that's in general about the average. It is one of the most widely studied form of bioidentical hormone replacement therapies, and I think we have back into the early 1900s that they've been utilizing these. Way back in the day, that's what they used for women who had to have total hysterectomies or in menopause. They used testosterone. And then Big Pharma happened, and then things changed. It's very individualized dosing. You have a steady stream of hormones in your blood, and there's a chart that we'll see here in just a minute. It's implanted under the skin, and you really don't have to do anything with it. We have a few rules you follow the week after insertion for men and 3 days after for women, and you're good to go. So here's some of the history of it. So this is 1939. Radical hysterectomies means no uterus, no ovaries, no cervix. Everything was removed, and it worked. They had excellent results with it. And then they started talking about estradiol and testosterone pellets for menopause. in 1949. So there's over 80 years of use. It's been used in other countries around the world, and it's really popular in Europe. And so it kind of went out of fashion here because we had the pills and the troches and the patches and the shots. And then we realized there's better methods, cleaner methods. And so it was invited back in, and it's really taking off. So this is what I was talking about, that chart that you can see. So you have your implants, it's a steady level of hormone. You have your oral pills, you take it in the morning, it falls off by evening, and sometimes you need to take a second, and it just goes up and down. And then the patches, it's on for a week, and then it starts to wear out, and then you put it on again, and then it starts to build up. So what is the Biote method? So it helps the body return to normal hormone balance and physiologic state. We have individual dosing, and the pellets are in the subcutaneous tissue in your buttock is generally where we put them. There's a couple other places that we can utilize should the need arise, but we tend to use that upper buttock area. And so there's lots of information on this slide. There's many studies that have been done with the Biote practitioners. We don't see an increased risk of breast cancer incidence. What we have found in our practice is we start doing hormones and we really start paying attention to women's health. And before people get started, we're starting to discover breast cancers. And this is in women prior to hormone replacement or who have been on an alternative type of hormone replacement therapy. So they come in and we do that screening. We screen for PAP, we screen for mammogram, we screen for prostate cancer as far as, what's your lab values, have you had regular follow-up? And so a lot of times if they try to say it's associated, it's because we find it when they come in for a consult and we talk about it and we say, you really need to do this first. And then what do? We let them go through treatment and we find, and there's a slide further down, that testosterone actually helps people stay in remission once their breast cancer is treated. And so we can offer different levels of therapy for different folks with different needs. So here's the breast health. I kind of got ahead of myself. So
we currently have 3 breast cancer patients that we're pelleting.
yeah, and they've gone through, yes, they've been through treatment and they feel much better. We don't treat them with estrogen. That's the big thing, is because of the receptors on many of the cancers, we don't treat with estrogen, and we watch what the testosterone does to their estradiol or estrogen levels. So here they have evidence that estrogen alone does not increase the risk of breast cancer. It's the form that it's in, what it's mixed with, that can increase that risk. And so we have a lot of studies, and we're happy to share that with anybody's doctor. We keep those articles handy that you can take and share if you want to get it cleared by other providers. So this is a study that they've done with hormone replacement after a diagnosis of breast cancer. And so what we have here is the proof that breast cancer recurrence was 17 per 1,000 person years in women who used hormone replacement therapy, and was 30 per 1,000 person years in non-users. So they had a decreased recurrence rate in people on hormone therapy. And then this is mortality rates at, does it say years? No. So people who died of cancer was lower in the group that was on hormone replacement versus those who weren't on. And then it's also changed 16 per 1,000 person years in those that were on hormone replacement therapy versus 30. So it's almost double the mortality rate in folks who don't use hormone therapy. So it's actually protective. So with bone health, this is what I wanted to share with you. So testosterone is a bone builder. We get 4-fold increase in bone density over oral estrogen and 2.5 times over the improvement with patches. So that's needing consistent use. That's appropriate use. But 8.3% increase with the testosterone pellets versus 3.5% for patches and 1 to 2% per year for oral estrogen. Osteoporosis is one of the reasons that insurance will pay for hormone replacement therapy. Why wouldn't we pay for the one that does the best work? Arthritis. This is bone health. When your bones get weak, when they get cranky, when they age, they hurt more. When we improve the bone density, we have less pain. So Alzheimer's disease, this is kind of a epidemic in women. Women get it 8 times more than men, or 8 to 1 if we're doing a ratio. What we need to do is keep our brain strong and healthy. And I think that goes to the point that women start losing testosterone so dramatically, so early in life that they don't have that protective force in play as they age. And so this is absolutely one of those things that we like to share.
Picture of that.
Uh-huh.
Alzheimer runs in my family really bad, and I'm gonna make sure my brothers see that.
Okay. So heart health, this is another area that hormone replacement gets a bad rap. So you go to your cardiologist, your blood pressure's high, your cholesterol's high. No, you can't be on hormone replacement therapy. It's going to make it worse. Well, what they know is the injectable that the traditional med docs will use. They'll give you the shots. Those do increase risk. What we have is a ton of evidence that with the Biote, bioidentical hormone pellets, it actually gets better. And this is another one that takes time. It didn't come on in your body overnight. It's not going to go away overnight. But as we monitor over a year, 2 years, we see vast improvement in those numbers. Your blood pressure starts to come down by increments. Your cholesterol balance improves incrementally over time. So we kind of talked about that. So you'll find a decrease in total cholesterol and LDL, an increase in HDL, and a decrease in triglycerides. Reduction in fat and improved lean body mass is part of the reasons for that. Your body can package those molecules better and excrete them and store them appropriately.
And once, like, they did give a ratio of, once you hit menopause, you have 1 in 6 chance of having a cardiovascular event at that time, just because we're lacking of those hormones, we're not communicating, our body's stressed, and so, yeah, definitely testosterone is beneficial for the heart.
Yep.
And prevention.
So here's some key takeaways of our talk tonight. So a hormone imbalance can occur in men and women at any age. Hormone replacement therapy is a cornucopia of therapies. Know the differences between the pills, the shots, the patches, the bioidentical versus pharmaceutical. We want to know which one is best for you, and I think we figured out which one is most effective with the most safety associated with its use. Low normal labs may not be optimal. What we want to do is optimize. So we don't just look at estrogen and testosterone. We look at your vitamin D, we look at your B12, we look at your cholesterol, and we look at your thyroid hormones. We want to make sure everything is optimized so you're in full balance. So there's that question and answer. I'd like to hand off to Amy. She's going to share some of our patients' testimonials.
Hi, my name is Amy, nurse practitioner here with Dr. Tilley. So when we first started pellet therapy a year ago, we didn't have the testimonials to go back on. We went through the program and listened to what their testimonies were. But now we're a year now into this, and we've seen people come back on repeat and asking them, why do you keep doing this? What keeps bringing you back? So I get to talk about the fun stuff and how good people are feeling after their pellet therapy. Numerous times it's over, it's the same things, and it's really good things. So we have patients that are generally coming in with anxiety, depression, the fatigue, the brain fog, all the things. So a lot of improvement basically in that. I haven't felt this good in 20 years. I hear that on repeat all the time. I wish I would have done this sooner. I wish I knew about it. 2 weeks ago, I had a lady that's it's on her 3rd pellets, and she suffers from seasonal affective disorder. And right before getting ready to do her pellets, she just starts crying before she lays on the table. And I'm like, what's wrong? What's wrong? And she's like, it's February, and I made it through the winter. So that was amazing. That was huge. That was huge for her. So one of the things that I think my coworkers too also realized that within 2 weeks we were sleeping really good. And we were like, gosh, I'm sleeping like a baby. And I also hear that, that people are sleeping a lot better. Stress incontinence is much better. Another scenario was I have zero control over my emotions. I cannot control them. I'm an emotional mess. I'm high, I'm low. I cannot deal with this. And then they would say, I went to my medical doctor, they would just try and give me a pill. And then after receiving pellets, they're doing so much better. with their anxiety, because a lot of times when we're deficient in our estrogen and testosterone, we're just angst feeling because our bodies are trying to compromise something that we don't have, and so we're just an emotional mess. And so giving the pellet therapy on a lady recently, she came back a week later. I wasn't here, unfortunately, but she was telling Kate, she was like just celebrating how good she felt, and she was just kind of more focused. Her anxiety was gone.
Yeah, that was after only a week, which is
Yeah.
not typical, but still, she was very excited. And she's like, I'm going to tell all my friends, and my sisters need to do this. Like her and her sisters, they all come in together. And yes, I'm surprised we haven't, seen them quite yet, but
Right.
but she's like, I have so many friends, and we're going to do this. And she was so excited that she didn't have to start something to control her anxiety.
Yeah. I do a 76-year-old. He was like, he had the history of Alzheimer's and dementia in his family, and he goes, I just want to make sure that I remember where I put my cup of coffee. So yeah, that was great. Let's see, another member said, I have motivation to get out of bed now. 2 men in their 60s say joint pain's gone. Their joint pain, I just do it for my joint pain and it's gone. What else?
Well, I'd like to share.
Libido,
Yeah,
always libido is always good.
Yeah. We've had a couple that said, I don't know what to do with it, but it's something that's new for them, and so sometimes I say, bring in your spouse. Maybe they need a little help too.
Yeah, I had a lady last week that said, for the first time in my life, I have not felt this good. Obviously I wish I would have done it 20 years ago. I know now what I have been missing my whole life. She said that I know the difference. Before, I didn't recognize it because I didn't know there was a difference. And she mentioned surviving versus thriving and how the majority of the population probably doesn't know the difference. So that was also a good one.
Right. Yeah. So I was going to share a little bit about my dad. So, and then I was going to talk about the metabolic reset too.
Yeah.
So my dad comes in and I pellet him. My husband comes in and he gets pellets with us too. But my dad is one of those that I moved him and my stepmother here from Kansas City because they were getting to the point that I was getting a phone call every 2 weeks. Linda fell, I can't pick her up. I pulled my shoulder, I've dislocated my hip, all of these problems. And I was driving back and forth and I said, guys, I'm your contact person, so you gotta come out here. And so when my dad moved out here, he was shuffling. He just had his 71st birthday this weekend. He started pellets in, I want to say, last summer. Yeah. And so he's had his 3rd pelleting. And what I have noticed is that his balance is better. He's no longer furniture surfing to find where he needs to go. He's standing up straight. He is confident. His memory's better, which has been an ongoing issue for him for quite some time. Part of what he's done is also another program that we do here that is not associated with Biote, but a lot of our Biote folks do this program. It's called Quantum Metabolic Reset. And what it is a all-encompassing body, mind, spirit program that helps through food, through intermittent fasting, through mindset work, create the highest level, healthiest self that you can have. And so we've had 12 of our members go through it, and half of them were on hormone therapy. And so what they were looking for initially was weight loss. They wanted to lose some weight. We had this extra spare tire. The midsection was getting a little thicker. Nothing works. I've done everything. I've tried all the diets. And so what we have found is our folks that are on Biote who do this program, it quantum leaps them into feeling better. So instead of having to wait a year for some of these results, we're seeing them in 3 months. And I find that it's absolutely phenomenal. So that's something that we offer here in addition to that. My dad followed that program. My dad told me last year his weight maxed out at 300 pounds. He said, I really didn't want to tell anybody about it. I know you could see it. And he said, So you told me about this program. You told me about the hormones. The hormones worked. I felt better. My pain was improved, which is a huge thing because he also suffers from severe arthritis and back pain. He's been doing the work with the quantum metabolic reset, continuing with the pellets, and he's down 54 pounds since October. And for me, seeing my dad look 20 years younger, he's like, hey, you want to go to St. Martin? We'll go to the islands together. I'm like, what? Who are you? And that's one of the testimonials that I have a close attachment to. But we've seen multiple others just thrive. We've had a fellow who retired from the Army after 30 years of service, 50 pounds lighter in 3 months. He's on the hormones. He's a believer. He did the quantum metabolic reset. He says, yes.
What's the quantum, what's that?
The quantum metabolic reset. So it's a 12-week program that I offer here that we give you a prescribed food plan. And there's weekly modules to teach you about different phases of life and wellness. So we talk about healthy home. We talk about parasympathetic nervous system. We talk about vagus nerve resetting. We talk about mindfulness. We talk about different elements that we need to move our body into the rest and digest and regeneration. Because if we're living in sympathetic outflow 100% of the time, which most of us are, we don't ever get to heal. We don't let the testosterone do the work. It's a tool. And if we don't let it function at its optimal level, which it does its work while we sleep, it does its work while we're resting, it does its work when we let our body not be inflamed. And so what it does is help reduce the inflammation. It helps reduce the stress and tension. And it gives you this new frame to live life from. And it's the retired Army guy. He's like, I don't know what you did, Dr. Tilley, but I remember my stomach doesn't have teeth, so I eat slower and I chew, which I had to teach the military out of him for that, which is hard to do sometimes. And he's like, I really didn't think a whole lot about spirituality, but I dig it. He's into it. And we're seeing that kind of across the board. I love hearing that. If we can get the whole person well, whole health, that's what we have here. And I want to offer that. It's not just here's your pellets, leave. We can support you in all facets to bring you into that optimal being. So we do that. And so my dad is a walking testimonial. He's a walking billboard. And if he can do it, because, he's not been able to have success. He's had heart attacks. He's had part of his colon removed. He's had alcohol issues. He's had all of these problems, and he's healing them. And he is better off for it. And so if I can offer that to one person, my dad, who I love so much, I love all of my patients. And I want the community to be able to receive optimal wellness. So
I think the other thing with your dad, he was talking the other day that he doesn't have the hand tremors anymore because he paints.
Yeah.
And he's a wonderful painter.
Yeah.
And so he said, he's visibly noticed that he can hold things and it's not so shaky anymore. So that's this other benefit.
He built the TV stand for me,
Picked up
and
the
I was
TV by himself.
a little worried because, I have recognized the tremor, right? So I was like, you sure? He's like, no, my fingers work again. They were talking about doing surgery on his thumbs because his joints were so bad. And in the last year, his dexterity has improved. His pain has dramatically reduced. His shoulders are no longer in so much pain. I was having to tape his shoulders regularly. His back pain, he's had 3 back surgeries. The wheel fell off, and so he's back here holding this with one hand, trying to put the caster back on. And I'm like, 6 months ago, my dad would have been on the floor with a TV on him. And so he's a changed man, and I know that this is the reason. So any questions? I want to open up the floor to questions. Did we say too much? You already got all the information you want?
How do we go forward?
All right. You want to push stop there? All right.